Hi, my name is Rita Masese. I'm a second-year graduate student studying global health at the Duke Global Health Institute. Over the summer, I was in Moshi, Tanzania, working on a project assessing the challenges and facilitators of effective transition of care from the adolescent clinic to the adult clinic among HIV-infected youth. Being born with HIV is no longer a death sentence. With antiretroviral therapy, youth are beating the odds of survival and growing on to become adolescents and eventually adults. Once they're adolescents and transition into adulthood, they have to move from the adolescent clinic to the adult clinic. However, this transition period is met with a lot of fear and anxiety, with frequent loss to follow up. My project was assessing the challenges and facilitators of this transition process, and hopefully the eventual goal is to form a transition protocol that will make this transition process easier. I was doing in-depth interviews with HIV-infected youth, where I was asking them what they found to be hard with transition and what they found to be easy. My findings were youth who successfully transitioned because they had a lot of family and social support. They also had a heightened sense of maturity, and they had a positive outlook on living with HIV. Youth who didn't successfully transition cited challenges as payment of services in the adult clinic, whereas the adolescent clinic was free. They also cited loss of their peer support and network. And they also cited stigma, particularly from HIV-infected adults who got HIV behaviorally as opposed to them who got it from their parents. With these findings, we hope to form a transition protocol that would address all these barriers and make the transition process easier and reduce the prevalence of loss to follow-up. Thank you.